Some big news about Alzheimer's research came out of an international research conference this week that showed there are things you can do now to reduce your risk of serious memory issues later. Talking about Alzheimer's disease, of course. And this is huge considering there's really no cure as of yet for Alzheimer's disease. So joining me to explain, I'm happy to have Dr. Kristina Zdanys from the UConn Health Center on Aging and Christy Kovel. She's the Director of Public Policy for the Connecticut chapter of the Alzheimer's Association. Thank you both for being here. Yes, glad to have you here. And Doctor, thank you for joining us. We'll start with you. Please tell us just about this lifestyle study. My understanding was it was huge. A lot of people they looked at. Yeah,
two actually huge studies coming out in LA this week at that conference you mentioned. So they're looking at different lifestyle factors that are going to reduce the risk of developing Alzheimer's down the road. And they looked at 5 different healthy habits. So that included not smoking, having limited alcohol consumption, a healthy diet, getting moderate to vigorous exercise 5 times a week, about 30 minutes, and then also keeping the brain active.
And if you can do 4 out of those 5 in the long term, my understanding was it reduces your risk, even for people who might otherwise be genetically predisposed?
Exactly. So Alzheimer's is complicated. Most people who have Alzheimer's, it's not strictly a genetic disease. Genetics can play a role, but what we learned from this study is that you can actually, even if you have some risk factors in terms of your genetics, you can reduce that risk by engaging in these healthy lifestyles.
And what do they mean by that cognitive stimulation?
Cognitive stimulation, right. So I think of cognitive stimulation as kind of like taking your brain to the gym. So when you go to the gym to work out, you're going to do some cardio, you're going to do some weightlifting, you're going to do some balance exercises, try to keep things well-rounded in terms of your physical health. So for your brain has many different parts, and those different parts have different functions. So if you can work out different parts of your brain by reading, by engaging in a class, by learning a new skill, those are all very important. And probably most of all is social stimulation. So being around other people and not just going online and visiting your friends virtually, but actually being together with other people.
That's an important point, because my first thought would have been, okay, do crosswords and things. And not that it's wrong, but social stimulation will light up different areas of the brain too. Now there's another study too, or at least more you wanted to add about this, right?
Yeah, absolutely. So the Alzheimer's Association, we're recruiting right now for something called the U.S. Pointer study.
Yeah.
So this is a large-scale clinical trial. It is a lifestyle study, so we're really excited about this, and it is going to be looking at lifestyle interventions for people at the greatest risk for developing the disease and seeing if things like exercise, sleep, social engagement can be helpful.
Yeah, and we can't get enough data on that, especially considering where we are in fighting Alzheimer's disease. A lot of treatments have been tried. None are really proven in the long term to work, only to ease symptoms. Also, it's not necessarily all that cost effective to always try and do tests, but there was some good news that came out of this recent study, that it looks like there might be a blood test that could be upwards of 88 to 90% effective in trying to diagnose it yet. Yeah.
That's absolutely true. So right now, when we're diagnosing Alzheimer's disease, there's very expensive brain scans that Medicare won't always pay for, and that are very cumbersome and very invasive.
Yeah.
So ideally, the goal is to identify proteins in the blood that you could get checked when you go to a doctor's appointment or regular physical exam. So I wouldn't be surprised in a few years if we're having some of these proteins for early detection as part of a regular checkup.
Oh, wouldn't that be wonderful? I mean, it just goes such a long way, too. But of course, this is a fight that has to happen on a lot of fronts, and legislatively, you got a big win.
We did. Governor Lamont just signed legislation we've been pushing for, and what this does is it adds dementia training to the curriculum for license renewal for physicians and nurses, so people can look at detecting Alzheimer's disease earlier. We want to educate those clinicians, and it's also important for people when they go to their doctor to be fully disclosing what the problems are and to ask those questions.
Yeah, and I've always felt like it's the role family members have to take in trying to figure out this diagnosis, and to even ask the right questions when you're bringing a loved one to the doctor is a big part of that too. So I imagine it's even more important when you have the doctors on board with proper training too. Congratulations! That must be a really big win.
We're really excited, and early detection, with all of this, it does cost savings for the family, better access to treatment options, including clinical trials, and also allows for families to plan. So if people have questions about their memory, they can go to alz.org and look for resources. We're here to help. We're here to help the families.
Yes, there you go. At least some good news in a problem that, by all estimates, is just going to explode as the baby boomers age and the population grows over time. This is a big problem we got to get a handle on, and they are helping to lead the way, as a lot of smart people are, in fighting Alzheimer's disease. Thank you so much for being here, Doctor.
Thanks for having us.
Thank you
so much.
Glad to have you here on the show.